Welcome to part 1 of our 4-part series on bovine fetal gender determination. This first installment will focus on basic ultrasound concepts and identifying the genital tubercle. So what's the benefit in determining the gender of a calf that a cow is carrying? Well, we're seeing an increase in the demand for this service due to its value in helping to make management decisions regarding who to sell, who to cull, and who to treat. Animals carrying a known gender may have the potential for higher sale prices. Our farmers and ranchers have an idea of how many replacement heifers they have on the way, and we can identify possible free martins when there are twins. Fetal sexing is traditionally done between about 55 and 70 days. However, with the quality of our modern equipment, we're able to penetrate deeper and at a higher image quality, and often we can determine gender significantly later. It's not unusual to be able to identify the gender of a bovine fetus at 100 or even 120 days now. The key to fetal gender determination is learning to identify and locate the genital tubercle, or the GT. This is the embryological structure that will develop into the genitals of the calf. It initially forms between the hind legs and begins to migrate after 45 to 50 days. In the bull calf, it will move cranially and end up just caudal to the umbilicus, and in the heifer calf, it moves caudally and ends up under the tailhead. This process is complete by approximately 60 days of gestation. Within this traditional window, the genital tubercle appears as a hyperechoic or bright white structure. It's often described as an equals sign or parallel lines, but that, of course, depends upon the resolution of your system and the stage of gestation. It will evolve to a more soft tissue echogenicity as it matures into genitalia. The scrotum and teats will eventually become visible as well, and that can aid in diagnosis later in pregnancy. While you can certainly just go out and start scanning once you know what you're looking for, we're going to try to provide you with a more thorough understanding of probe handling and orientation to reliably get the image that you need for diagnosis. Remember that each time you want to strive to obtain a negative and a positive identification. So if you see a male GT, be sure to check for the lack of a female GT and vice versa. This is not only to weed out anomalies, but because there are other structures that might confound you, especially in the beginning. Sometimes a cross-section of a fetal femur can appear to lie near the position of the male GT, for example, and the dense tailhead can look a lot like a female GT. The best advice that I can give you is to train your eye to recognize the GT first. Watch as many video examples and go through this presentation as many times as possible from the comfort of your own home before doing it in live cattle. The identification of the GT will become relatively easy, but it's made much more difficult when you're simultaneously trying to physically obtain the ideal image in an uncooperative and moving animal. Don't get frustrated, it can take a lot of practice. These images are from the Drost project, and they depict the gross appearance of the structures we're looking for. In the female calf, the GT is found just under the base of the tail, and in the male calf, it's located just caudal to the umbilicus on the ventral abdomen. In the corresponding ultrasound image, the GT is seen as a highly echogenic, dense structure. In this female fetus, you can see it adjacent to a cross-section of the tail at the caudal aspect of the fetal body. And in the male fetus, it's seen here adjacent to the cross-section of the umbilicus. How do we go about looking for the genital tubercle? Well, first we need to review a few basic ultrasound concepts and go over probe handling. The array is the part of the transducer that produces the ultrasound signal. 128 crystals are lined up along the array, each producing sound waves to send out into the tissue and then listening for the returning echo. These individual thin beams combine to form a sheet or a curtain of sound waves, and the shape and size of that curtain depends on the shape of the array and the operating frequency of the transducer. I like to think of the long axis of the rectal probe's array like a kitchen knife. Just as the knife slices through a piece of fruit, The curtain of sound waves from the transducer slices through the anatomy underneath it. On the left, we're illustrating that cutting through an orange across its middle produces a pinwheel appearance. But when sliced in a different orientation, from stem to navel, the cut section has a very different bilobed view. On the right, we see that the transducer's sound curtain is slicing through the little fetuses in two orientations, producing the images seen below. As a brief reminder, on the left we see the approximate typical orientation of the transducer situated in the rectum over the body of the uterus. And here on the right, this little goat is standing in for a bovine fetus. While the names don't really matter, the three planes that are shown are the ways in which we can view a fetus. For fetal sexing, the frontal and transverse planes are used most often. Imaging in the frontal plane, also sometimes called the coronal or the dorsal plane, involves the long axes of the probe and the fetal body being parallel, with the fetus on its side relative to the imaging plane, which is then slicing through it from side to side, as opposed to top to bottom as in the sagittal plane. The resulting ultrasound image looks as though you're viewing the fetus from above, with cross-sections of ribs visible on either side of the thorax. The frontal plane is perhaps the view that we use most often for fetal gender determination, because it places the male GT in the same slice and adjacent to the umbilicus, and the female GT in the same slice and adjacent to a cross-section of the tail for reference. A transverse or cross-sectional view places the probe array perpendicular to the long axis of the fetal body. The resulting image looks like we cut the calf across its abdomen. You can see the fluid-filled rumen and the folds of the fetal omasum in this example. This view requires a bit more experience for fetal sexing than the frontal plane, because while the GT can be seen in a transverse view, the male GT in particular won't usually be in the same plane as the umbilicus. So the diagnosis is therefore made on a good understanding of its location without necessarily having a simultaneous view of these landmark structures. Similar to the frontal plane, when we're imaging in a sagittal plane, the long axis of the fetal body is parallel to the long axis of the transducer array, but this time scanning in a dorsal to ventral or ventral to dorsal orientation as shown. This results in an image that looks like a side-on view of the calf. A perfect view in this plane would theoretically show the umbilicus, the male GT location, the female GT location, and the tail all in the same slice. But obtaining that perfect alignment requires a lot of precision. Of course, part of the challenge of fetal sexing is obtaining one of those ideal imaging planes. Much of the time, we're likely to fall initially into an oblique view that's difficult to interpret. So learning to manipulate your probe to achieve the desired view is half the battle. Remember that the ultrasound image is giving you a two-dimensional representation of a 3D structure. It's just showing you that one thin slice where the curtain of sound waves is cutting through. So that brings us to probe handling. The way in which you move your transducer will change the image that you're viewing. For better or worse, in large animal reproduction, we have our arm in a small tube, and that, combined with the shape of the transducer head, limits the kinds of movements we can make. However, there are 4 basic movements that can be done with any ultrasound probe and for any purpose to explore that third dimension of a structure. Pressure, alignment, rotation, and tilt make up the acronym PART. Pressure is quite simply the downward application of pressure on the probe to make contact with the body surface, in this case the rectal mucosa. Good contact is vital for nice images, so remember to use lots of lube, sweep excess manure away, and minimize the amount of air being allowed into the rectum. Alignment refers to physically moving the probe around on the surface. Examples would be pushing the probe further in the rectum or sweeping the head side to side to examine the uterus underneath. Rotation refers to twisting the probe in order to change the orientation of its long axis. In other words, rather than pointing the transducer straight toward the head of the cow, you might rotate it slightly to point toward her left shoulder, but all while maintaining the same contact with the rectal wall and with the array pointing straight down. Tilt includes two movements. Fanning is the one we will use most commonly with a rectal probe, and that involves holding the body of the probe head still in one location and simply tilting it side to side along its long axis. Rocking is similar in that you don't change the location of the probe, you're just tilting it to one direction or the other. But this time we're rocking it end to end, which is much less common with a rectal probe. Now that we have some tips for probe handling, how do we interpret the images that we obtain? A major landmark that we will use to locate the male GT is the umbilicus. The umbilicus forms a thick stalk and enters the mid-ventral abdomen of the fetus. Thanks to the presence of both large vessels and soft tissue, the umbilicus looks a bit like a divided highway or a strip of bacon with its alternating echogenicities when viewed in the sagittal or transverse planes. When viewed in the frontal plane, the cross-section of the umbilicus is larger and less echogenic than that of the adjacent male GT. The associated vessels can be seen in cross-section as dark spots within the tissue of the umbilicus, reminiscent of a chocolate chip cookie. Here we can see examples of the umbilicus in various orientations. Sometimes you'll be able to see that it's a bit twisted, but that classic appearance remains. Since fetal sexing really relies upon dynamic evaluation of moving images, that brings us to our first examples. I'm going to let each of these play a few times through, and then we'll slow it down and identify the GT. This male example is a 59-day pregnancy in the frontal plane. I hope you got a good look at that. Let's scrub through it and look at it a little bit slower. Here we can see the round, soft tissue echogenicity with the black vessels of the cross-section of the umbilicus. And just caudal to it, we see the brighter white, smaller, hyperechoic male GT. The umbilicus, and that male GT. Here we see that male GT again, the two hind limbs, cross sections of the hind limbs next to it, and the umbilicus cranial to it. Our female example is slightly further along at 65 days of gestation, and also in the commonly employed frontal plane for an apples-to-apples comparison. This clip is much quicker than the last one, so we only see the female GT at the tail end of the video clip. The video begins toward the fetal head. We can see rib shadows and the abdomen to the right. And just at the very caudal aspect of the fetal body, we see this female GT come into view. It's right at the cleavage of the hindquarters. As we scroll through, we can see the two hind limbs, the musculature of the two hind limbs come into view. Here we see the umbilicus with no male GT, just caudal to it. And back at the tail end, we see that female GT pop up again. Nice, bright white hyperechoic. This is a cross-section through the tail. And then outside, we have the amnion surrounding the fetus. So in conclusion, remember that regardless of the plane that you're scanning in, you need to move through all three dimensions to make a thorough evaluation. Be sure to check caudal to the umbilicus and under the tail so that you get both a positive and a negative identification. In the case of twins, consider the possibility of Freemartinism. If you're unsure, don't be afraid to come back and recheck. It's helpful to write down your answers so that you can check yourself when the calf is born and make note of any anomalies you identify. And if at all possible, store images to your ultrasound machine while you're learning so that you can come back and look at the images after the fact. Remember that these need to be video clips and not still frames. I want to give credit and thanks to Dr. Sandy Curran for providing most of these featured images. Be sure to come back for part 2 of our 4-part series, where we'll focus on identifying the male fetus.